One day in August 2013, a letter for help arrived at the Research Center for Eco-Environmental Sciences, or CEES, Chinese Academy of Sciences, CES. It was from a Sri Lanka trainee who once attended the training program of water and sanitation organized by the RCEES in November 2012.
我们以前的一位培训班学员从斯里兰卡发来邮件，告诉我们，在斯里兰卡有一种不明原因慢性肾病，希望合作开展追因研究。
Actually, somewhere like 1985 onward, Sri Lanka was terribly affected from a disease called chronic kidney disease.
Most of the severe patients suffering from chronic kidney disease are male farmers between the ages of 30 to 60. The CKDU cases are mainly concentrated in North Central Province, Northwestern Province, and Uva Province. After getting sick, they gradually lost their labor ability, and the costs of treatment became heavy burdens on their families.
His Excellency the President, when he visited this official visit to China, he met the Excellency President, Chinese President, and he asked whether Chinese government can help us. For that request, immediately Chinese President react and Chinese Academy of Science came forward.
2015年3月26日，在双方元首见证下，中国科学院和斯里兰卡供水部在北京签署了合作备忘录。不明原因慢性肾病追因合作以及共建中斯水中心被列入两国政府联合声明。中斯水中心的成立具有划时代的意义，这是我们国家践行人类命运共同体的理念，紧贴当地民生需求部署的第一个海外科教基地。
The Research Center for Eco-Environmental Sciences, RCEES, CES, is the core of the Chinese project team, with other relevant research institutes and medical institutions deeply involved, and some water enterprises following up and implementing the action plans. Sri Lanka project team consists of Ministry of Water Supply, Ministry of Health, National Water Supply and Drainage Board, NWSDB, and University of Prodemia. Both sides formed a cooperation scheme as to integrate resources from the governmental agencies, enterprises, universities, and research institutes from China and Sri Lanka, and explored a cooperation model of human capacity building, cooperative development of technologies, and implementation of solutions by enterprises. The cooperation team covers interdisciplinary high-level experts from different institutions, including water science, geology, medical science, and public health. They dedicated their efforts to starting the courses of CKDU and the development of the available water supply technologies, including rainwater harvesting, electrodialysis, and nanofiltration for local people in CKDU-affected areas. After months of intensive research, the expert group from both sides put forward the action plan of both improving drinking water supply and tackling the CKDU issue. After a decade of efforts and cooperation, a wonderful building has risen on the campus. The China-Sri Lanka Joint Research and Demonstration Center for Water Technology, jointly established by both countries, is equipped with advanced water quality analysis platforms and is jointly managed and operated by the Sri Lankan Ministry of Water Supply, University of Prodemia, and the Chinese Academy of Sciences.
我们在斯里兰卡开展研究也是两手抓。第一个是找病因，这可能10年甚至20年也搞不出来，但是你一定要去做。在研究过程中，通过地下水水质分析和关联水质因子的独立学实验，我们发现地下水中高浓度氟离子与硬度组分等的联合作用，可能是造成 CKDU 的重要致病原因。第二个就是改水，改水的成效呢立竿见影。我们开发出低成本去除氟离子和硬度组分的选择性电生系技术，和 和纳尼膜净化技术，建设了担负型、村级以及社区级水质净化工程。
To teach people fishing is much better than that of giving them fish. Since 2015 till now, the CAS has cultivated nearly 40 masters and doctoral students in water and environment, trained 30 water professionals from Sri Lanka, and provided funding support for a group of academicians and scholars to conduct collaborative research in China. Meanwhile, 50 medical workers in the CKDU prevalence areas supported by the China team were invited to Beijing to take part in training programs from Peking University First Hospital and Beijing Center for Disease Prevention and Control, respectively, improving their abilities of CKDU prevention and epidemiological investigation.
As a nurse, I am very happy to say training was very helpful to us, to our clinical practices. Again, from your countries, it was very helpful. Our patients are very need more help from healthcare workers.
This time, the Chinese government has come forward to help us in establishing a research and demonstration laboratory in Peradeniya.
As a result, we have now initiated this several MOUs we have signed.
And actually speaking, this JRDC, this China-Sri Lanka Joint Research and Development Center is a very big asset to the faculty.
I feel JRDC will be a door for us to connect east and west of the world. So we want to make Sri Lanka is in a very, very important position in Indian Ocean.
I think Sri Lanka and China collaboration is lifetime.
The government is very much thankful to the people of China and the government of China.
අලුතෙන් අපි පත්තු නිමිතින් අලුතෙන් මේක අවුරුද්දක් විතර පිටින් කරගෙන ආවා. ඒ එනකොටත් වතුර ගෙනියන්න පාරිභෝගිකයෝ කිව්වේ මේ වතුර ඇත්තම හොඳයි කියලා. මොකද ආරෝ වතුර යාලට බීපුවාම ඔය බඩේ දෙවිල්ල වගේ ඒවා හැදෙනවා කියලා.
那么从这个中心联合中心来看的话，我们不是一个简单的条钥匙，而是考考的对象。This is the flagship of China and the flagship science and technology, the cooperation between China and Sri Lanka.
我们在做“一带一路”这个工作的过程中间，我们更多考虑的就是帮助当地能够去解决一些实际上的一些问题。
In July 2024, Professor Yang Ming and reported major achievements of water science and technology cooperation between China and Sri Lanka in the past decade. The Home Prime Minister, Mr. Gunawardena. In September 2014, Professor Yang Ming met Mr. Gunawardena and discussed joint research on CKDU, studies in drinking water supply. Over the past 10 years, both China and Sri Lanka have jointly invested a total of over 200 million RMB, 8 billion Sri Lankan IS, to establish a top-tier research platform in Sri Lanka and South Asia, while cultivating more than 120 Sri Lanka professionals in science and technology and management. Dr. Madhubashini, as the first Sri Lanka doctoral graduate, has become the director of the JRDC, and Professor Parakrama and Professor Gamini have been assigned as the chairman of UOP JRDC Research Committee. Compared to 2017, the incidence rate of CKDU in North Central Province, Sri Lanka decreased by over 20% in 2020. Currently, China and Sri Lanka have established a team to focus on addressing challenges of rural drinking water safety and security. Such cooperation aims to provide a comprehensive solution for Sri Lanka to achieve UN SDG 6 clean water and sanitation by 2030. In the future, both parties agreed to expand cooperation to air pollution control, soil science, and sustainable industrial development in order to benefit more local communities. From shore to shore, it seems wide at high tide. Before fair wind, a single sail is lifting. Moving forward, both China and Sri Lanka are committed to establish the JRDC as a model of international science and technology cooperation